Hello, my name is Mrunali Dhage. So today I will be performing ear examination. Is that okay with you?
Yes.
So before we start, may I know your name and age?
My name is Aditi and I'm 22 years old.
Okay, so first I will be inspecting the auricle. For that I will ask my patient for any tenderness or pain.
No.
So I will check for any lumps, lesions and deformities. So I will perform the same with another ear. So next I will continue with ear canal and eardrum examination. For that I will be using an otoscope with the largest speculum so that it can insert into the ear gently. Now I will position the patient's head so that I can examine comfortably. So while using the otoscope, make sure to hold it in right hand for right ear and left hand for left ear between the thumb and index fingers, like holding a pen. Now grab the auricle gently but finely, pulling it upwards, backwards and outwards. So now insert the otoscope in the external auditory meatus and examine for any wax, discharge, inflammation and abnormalities. Gently proceed down the canal until the tympanic membrane is seen. Check for the cone of light and note for any discharge. If discharge seen, check for the color, smell and consistency. Now repeat the same for the left ear and make sure the otoscope is held in left hand. So now I will be performing whispered voice test. For this I will ask my patient if she is having any difficulty in hearing.
Yes.
Okay. So the patient is having difficulty with hearing. So now I will be performing the test. So for this I will close one of her ear and rub gently in circular motion and whisper 3 numbers in another ear.
3, 5, 7.
And I will repeat the same with another ear. So now I will be performing tuning fork examination. I will be beginning with Rene test and for that I will be using 512 Hz tuning fork. So now I will strike the tuning fork against a hard surface and place it over the patient's outer ear. This tests for air conduction. And then I will place the still vibrating tuning fork behind the patient's ear over the mastoid bone, which tests for bone conduction. So I will ask the patient if the sound was louder in front or behind the ear.
In the front.
Okay, so this means the air conduction is more than bone conduction, which means positive Rene test. So when bone conduction is more than air conduction, it is conductive hearing loss, which means Rene negative. And when the air conduction is more than bone conduction, it is sensory neural hearing loss when the Rene is positive. Now I will be performing Weber test. For that I will strike the tuning fork against a hard surface and place the base of the tuning fork over the patient's midline. And then I will ask the patient where the sound was heard, in the left ear, right ear or in the middle.
In the middle.
So this means there is no lateralization, which means normal hearing.
Hello everyone, myself Dr. Chahat. Today I am going to do nose examination. First I will do the inspection of nose. Now I will check the any asymmetry or deviation first from the frontal side. Now the lateral side. So there is no asymmetry and deviation. Now I will palpate to check swelling and tenderness of the sinuses. First maxillary, now ethmoid, and now frontal. So everything looks normal, there is no swelling or tenderness. Now with the rhinoscope I will check the nasal cavity for any deformity. Now left side. There is no bleeding, terminates are fine and there is no polyps seen. The examination is done. Thank you.
Hi, I am Dasya Parita. May I know your name and age, please?
I'm Aranja and I'm 22 years old.
I am here to examine your oral cavity. Is it okay for you?
Yes.
So, firstly, I will check your lips. If there is any discoloration, nodules, or scaling or scars on it. Now, I will check your oral teeth with the help of both light and tongue depressor. Please open your mouth. I will be checking your tongue if it's in midline. and also the oral mucosa, if there is any white patches or discoloration on it. I'll be examining your gums and interdental fistula with the help of glove pen. Open your mouth. I'll be also checking if there is any missing teeth or a displacement of teeth. Open your mouth. Say ah, ah. I'll be checking your ulvar movement, soft and hard palatine, your tonsillitis, and posterior pharyngeal wall. Now I will be lettering your tongue. Open your mouth. To check the submandibular and sublingual glands opening. In my examination, I didn't find any pathology or abnormalities in your oral cavity. Thank you for your cooperation.
Hello, I am David Veterinary Ansi. I like to do neck examination with you. Is that okay for you?
Yeah.
Okay, before we start with the neck examination, make sure to sanitize your hand. First, I will start with the inspection. Inspect the neck for and check whether the patient has any deformities or abnormalities are present. Now, I will palpate the neck and check whether I will to appreciate any kind of masses or any lymph node swelling able to feel. Okay, now I will palpate and auscultate carotid pulse. For that, I will place the patient in supine position with the head elevation to 30 degree. Then I will first palpate the carotid pulse one at a time. And it is important to check the carotid pulse in order to access the cardiac function. I feel the amplitude of the carotid pulse. Now I will auscultate the carotid pulse. While auscultating, I will ask the patient to hold her breath so that I am able to appreciate the broods and chill sounds of the carotid artery. Next one is thyroid examination. For that, I will ask the patient to swallow and observe whether I am able to appreciate any kind of thyroid enlargement. Okay. Now I will palpate thyroid bone, then thyroid cartilage. Then I will ask the patient to sip some water. Can you see? Then I will check whether I am able to appreciate any kind of masses or nodules on the thyroid gland. Okay, I have done with the neck examination, and thank you for your cooperation. Thank you.
Good morning, I am Cletus Aranja Vijayan of Block 3B. So today I'll be performing the lymph node examination of the neck. I'll be feeling glands on your neck. Is that okay with you? So first, submental lymph node, submandibular, tonsillar, parotid, preauricular, postauricular lymph node, upper, middle and lower jugular lymph node, supraclavicular and infraclavicular lymph node, occipital lymph node. Now I will be checking for thyroid. Can you sip some water? Swallow it slowly. Thyroid gland mobility is normal. So our physical examination ends here. I did not find any abnormalities. Thank you for your cooperation.